Good afternoon, everyone. My name is Dana Goldman. I'm the director of the Schaeffer Center for Health Policy and Economics, and also the interim dean at the USC Price School for Public Policy. And I'm really pleased to introduce our second Richard N. Merkin, MD, Distinguished Speakers Series. And we have two excellent speakers, Lauren Miller Rogen and Paul Aisen. But first, I want to just express my gratitude to Dr. Merkin, whose philanthropic leadership and commitment to improving healthcare has made this series possible. His support at the Schaeffer Center helps bring together policymakers, experts, and industry leaders to discuss some of the most pressing problems in healthcare facing the United States. And when you think about that topic, two issues come to mind: COVID, which was the subject of our prior lecture series, and of course, Alzheimer's. And today, in particular, we want to talk about research, advocacy, and the fight against Alzheimer's. And we have two speakers today, as I noted. And I should say at the outset that generally I just engage in a discussion with the speakers on various topics. But in this case, I've had the unfortunate disadvantage of being the speaker after both Paul and Lauren. Lauren and I met at the California Institute of Regenerative Medicine, where I followed her talk there, and Paul I followed his talk through our Brookings series, and they're both outstanding speakers. And so we're going to do things a little differently, and we're going to give them an opportunity to present, and then we'll do the Q&A. So first, let me introduce Lauren Miller Rogen. She's a screenwriter, director, producer, and philanthropist. Her artistic accomplishments include co-writing and producing the film For a Good Time Call, and writing and directing the Netflix dramedy Like Father. She also co-founded Hilarity for Charity, now called HFC, whose mission is to care for families facing Alzheimer's disease, educate young people about living a brain-healthy life, and activate the next generation of Alzheimer's advocates. And as I mentioned, she's on the board of California's Institute of Regenerative Medicine and sits on California's Alzheimer's Task Force. Lauren, please proceed.
Thank you. Thank you so much for having me today. I'm so excited to be talking to all of you about Alzheimer's and about brain health. As Dana said, I'm Lauren Miller Rogen. I guess we'll start with first a little bit about me. Unfortunately, Alzheimer's has always been a part of my life. My mom's father, my grandfather, there he is, Grandpa Marty, had it when I was very young. He passed away from it when I was 12. And then my grandmother, seen right there, Grandma Edie, she had it, or Parkinson's with Lewy body, some other form of dementia. The doctors never quite gave her a diagnosis, but she passed away when I was 18. And then a few years later, when I was 22, and my mom, there she is, Adele, who was a teacher for 35 years and was only 52 at the time, started repeating herself. When we got the diagnosis, when she was almost 55, none of us, unfortunately, were very surprised. We were just really scared. After what we had seen from my grandparents, we had an idea of what we were in store for us. So at first, my mom was very embarrassed by the disease. She didn't want us to tell anyone about it. She wanted us to keep it a secret. She really felt the stigma about Alzheimer's. But eventually she forgot how to use her voice. So I decided to use mine. And I used it to try to find some hope in what felt like a currently hopeless situation. So we started with a variety show in Los Angeles in 2012. We raised about $300,000. And after that, we started being contacted by young people who appreciated hearing from another young person talking about being affected by a disease, which seemed to only kind of be giving older people a voice. So we decided that we had an opportunity to really spread a message that people didn't know a lot about, And we officially founded Hilarity for Charity, now called HFC. And in the almost 8 years since we began, we've raised over $12 million, which we've used to help people that are struggling with Alzheimer's disease today and tomorrow. We help people today by offering support to them through online support groups, and of course, through our Alzheimer's and Dementia Care Relief Grant Program, through which we provide at-home care to individuals who are most in need. To date, we have awarded over 270,000 hours of care to people who have chosen to care for their loved ones in their homes. As for how we invest in tomorrow, our main focus is funding research and teaching people about how to keep their brains healthy and perhaps delaying or even preventing Alzheimer's. So I'll start with a few facts first. Okay, so it's believed that Alzheimer's starts in the brain 20 to 30 years before the symptoms appear. Currently, there are close to 6 million people living with Alzheimer's in the US. The NIH reports that 1 in 7 people aged 71 and over will have dementia of some kind. And by the time an individual reaches the age of 85, he or she has a 50% chance of having Alzheimer's. And women, unfortunately, are almost twice as likely to develop Alzheimer's, not because they may live longer, but because of hormonal changes that are specific to women as they age. And then finally, unfortunately, I know that we're going to spend some time discussing this today, and obviously Paul is on the forefront of amazing research, but there are currently only a few FDA-approved drugs that help symptoms in some people who take them, but there are no medical treatments or interventions which can cure or even slow the progression of Alzheimer's disease. However, there is hope. There are things we can do, and that's what we do at HFC. So we'll dive in. Very smart doctors, of which I am not a doctor, I write movies. But very smart doctors have told me that living a brain healthy lifestyle can actually delay or prevent this disease. In fact, 1 out of 3 cases of Alzheimer's might be preventable if one lives a brain healthy lifestyle today. So when it comes to our brains, we have both modifiable and non-modifiable risks. So what are the non-modifiable risks? Age, of course. The older you are, the higher your risk is to develop Alzheimer's disease. And then, of course, there's our genetic makeup. A little quick note on genetic makeup. People often ask, look, again, I'm not a doctor, but I will tell you my sort of very basic knowledge, which is there are a few genes which can point to your Alzheimer's risk. There's the PSEN1 and 2 genes, which are dominantly inherited. They're responsible for that really early onset Alzheimer's in one's 30s or 40s. It's very rare, makes up about 1% of Alzheimer's cases. Then there's the APOE gene, which you may have heard of. It's the most common, I would say it's the most commonly spoken about in relation to Alzheimer's. There's APOE 2, 3, 4. Having 1 or more copies of APOE 2 actually can reduce your risk of Alzheimer's. Pretty cool. Having 1 copy of APOE 4 somewhat increases a person's risk of late onset Alzheimer's. 2 copies may increase that risk more. But regardless, if a person has 1 or 2 copies, a person will not necessarily develop Alzheimer's. And that's why it is so important to focus on the modifiable risks, what you can do to keep your brain healthy. So things we can do. There's diet, there's making sure your blood pressure is healthy, exercising, sleeping well, keeping your brain stimulated, taking care of your emotional well-being, controlling high blood pressure, high cholesterol, diabetes. Let's break it down a little. Okay, so sleep. Sleep is the easiest thing you can do to take care of your brain. It's free. You can control it. You can work on it to make it better. You want to sleep between 7 and 8 hours a night. Things you can do to increase your sleep. Avoid caffeine after 1 o'clock. Have a consistent bedtime. I know for me during this whole pandemic, it's been so easy to really improve my sleep because I'm not going anywhere. I'm going to bed at the same time and waking up naturally the same time every day. You want to avoid looking at your phone before bed. If you do, get blue light glasses. We're looking at our screens all day these days. Find some blue light glasses. It'll help your brain throughout the entire day. You can wear them. Your sleep quality, like I said, is so important. You want to have a cool bedroom. You can get something to cool your bed, or there are mattresses that have cooling pads. I should add that over-the-counter sedatives like Ambien, Tylenol PM, not good for your brain. My doctor always says there's a difference between sleeping and being knocked out. And that's what those drugs do. Okay, so then there's nutrition. We'll move along. Look, it's hard. We're in a time, all I want to eat right now are cookies and macaroni and cheese, and I get it, but that's not good for your brain. So you want to stick to a Mediterranean style diet. It's really good for you, something low glycemic, low saturated fat. Ketogenic diets are really good. Intermittent fasting is really good. You can do caloric restriction that way. Some little things, easy things to do. Eat blueberries. Blueberries have been shown to be really great for your brain. Eat a cup of them a couple times a week. You want to have fish. Salmon is really great for your brain. Omega-3 fatty acids, really, really important. Dump olive oil all over your food. It's so good. And it's really, your brain loves olive oil. You can add cocoa flavonols to your coffee. Really good quality cocoa is actually good, high quality chocolate. Good for your brain. That's an exciting thing. Okay, next one, exercise. I was an active kid, and when I became an adult, all I wanted to do was sit on my butt, but you can't do that. And I always thought the people who said they were addicted to exercise were lying, but they're not. And I see that now, and you just have to find something that works for you. Look, a lot of people focus on their steps, and that's better than sitting on your couch, but it's not about just walking around. It's about getting your heart rate up. High intensity interval training is really great. You want to build muscle. Building muscle can really keep your brain really strong. So lift those weights, get your heart rate up, move your body, find something you enjoy. And then of course there's mental stimulation, learn new things. You're all very smart people. You're constantly learning. I don't have to tell you much, but an interesting thing that I've learned along the way is actually people always talk about, I do crossword puzzles. Crossword puzzles, yes. Again, better than sitting on your couch and watching reality television, which I do sometimes. But what a crossword puzzle does actually accesses old information. And what you want to do is learn new information. So take up a new instrument, learning new things, seeing your doctor regularly. We touched on this earlier, but avoiding high blood pressure later in life, low blood pressure later in life, avoid these things. You want to check on your cholesterol. These things really have an impact on your brain. So having good health check-ins with your doctor is really important. Supplements, these things are really personal to our health, but having good omega-3 fatty acids are good. You can take some DHA and EPA. I take curcumin. Your B vitamins are important. Vitamin D, really important. We don't get enough of it, and it's really important. And then finally, one of the most important things, chill out. Maintain a healthy emotional well-being. You want to minimize stress. Stress is so bad for your brain. And again, these are such wild times we're all feeling it. But, try to develop some hobbies that bring your stress down. Perhaps it's meditation. I started doing pottery 2 years ago, and it just makes me take a breath when I do it. And that is so, so good for your brain. So in the end, I will say this, that when my mom was diagnosed with Alzheimer's, and I started talking and learning about Alzheimer's, I did not feel a lot of hope, but now I do. And I fully believe that this will be a different disease in 5 or 10 or 20 years. And that is really, really exciting. And until then, you can follow my organization, We Are HFC, to learn more about keeping your brain healthy. And go out there, move your body, learn something new, take a deep breath, think about your brain. Thank you.
Thank you, Lauren. And we're going to have a lot to discuss about what you said, but I would like to point out that the dean of our gerontology school, we're one of the few schools of gerontology in the country. He is taking a ceramics class at USC, and he's taking it with his daughter. So not only is pottery good for the brain, I think, but it's also good for familial relations. So.
It's a really universal hobby.
Paul, on that note, please.
Thanks, Dana. To start off, this is a picture of Dr. Alois Alzheimer, shown on the left. And he described this disease in 1906 and had a detailed report on the first patient shown in the upper right, who was a middle-aged woman with rapidly progressive dementia. At death, Dr. Alzheimer examined her brain and he saw some abnormalities that he drew. And you see that in the lower right. He drew tangles. He also drew what he called miliary deposits, and we now call plaques. So he established that plaques and tangles are the two abnormalities in the Alzheimer's disease brain. Now, we've come a lot further since then, but we still say that the lesions of Alzheimer's are the plaques and tangles. Now, instead of drawings, we use photomicrographs, and they're shown on the lower part of this slide, where you see on the left a plaque, which is a deposit of an abnormal protein material in the substance of the brain. And on the lower right, you see a tangle, which is inside the cell body of a brain cell, a neuron. And if you look at the brain as a whole, shown in the cartoons at the top, a normal brain looks like the picture on the upper left. And the Alzheimer's disease brain shows marked shrinkage, marked atrophy, particularly in those lower areas, which are the medial temporal lobe areas, and are the site of memory formation. And so the atrophy is worse there, and that's why the prominent symptoms are related to memory and learning. The clinical course of Alzheimer's disease has historically been described as shown on this slide. The disease starts as a dementia, which just means impairment of memory and other aspects of thinking, severe enough to interfere with daily activities. And the dementia progresses over an average of about 7 years to death. There is some cognitive impairment that occurs before that we have called a mild cognitive impairment, but we've generally said that Alzheimer's disease on average runs a 7-year course. We've learned a lot more about the cause of the plaques and the tangles, the underlying lesions in Alzheimer's disease. And I'm not going to have time to fully explain this cartoon, but the normal brain structures are outside the bubble, and inside the bubble is a summary of what goes wrong in the Alzheimer's disease brain. And it starts with the abnormal clipping of a protein, which is that blue, yellow, pink worm that's extending through those circles. The circles represent a cell membrane, and it is a transmembrane protein called APP that gets abnormally clipped in Alzheimer's disease to release a fragment which is very sticky and sticks together and forms clumps and eventually deposits as plaques. So we know the cell biology and the biochemistry of the plaques, and we understand some, but not all, of the ways that the accumulation of the plaques made up of this material called amyloid lead to other changes, such as disintegration of structures within the cell, like microtubules, which transport chemicals, and mitochondria, which generate energy for the cell, and that these changes lead to the formation of the tangles within the cell. So we have a good understanding of the science of the lesions that Alzheimer first described in 1906. But for most of the last century, we really couldn't go much further in terms of interrupting these processes or even visualizing these changes in the living brain, because the plaques and tangles are microscopic and they can't be seen on CT scans or on MRI scans. But we had a really major breakthrough about 15 years ago with the advent of a new technique, and it's shown on this next slide, if I can switch my slide. Yeah. This technique is called PET scanning, PET imaging. It's a way of looking at the brain, not using magnetic imaging or X-rays, but rather by labeling molecules and then having those molecules emit a radiation that can be picked up in a camera. And using different tracers, we can now label the amyloid in brain and see it in living people and track its progression. And very recently, just the past few years, we've learned how to label the tangles by labeling the tau, which is the component of tangles. And the column of images on the left is a column showing tangle formation and tangle spread. So the abnormalities in these images are the color. And some degree of color is normal, the blue is normal, but the red is showing abnormal accumulation. And the 3 lines of paired scans here are showing progression from totally normal scans to abnormal amyloid, but not very abnormal tau in the middle of a clinically normal older person. And then dementia, AD dementia, is marked by serious abnormalities of both amyloid on the left and tau on the right. We can now see this in living people, so we can make a very accurate diagnosis. We no longer talk about probable Alzheimer's disease. We can make a definite diagnosis, and we can track progression. And this type of tool has led us to reformulate our conception of the disease. And we no longer think of this as a 7-year course of dementia. And Lauren mentioned this in her talk, but we now know for sure, using these scans, that Alzheimer's disease actually lasts over 25 years. We can now see by scanning people as they get older that the disease starts with the deposition of plaques or amyloid in brain, and that's shown here in the red line. And in the green line on the right side of this graph, you see the loss of function from cognitive impairment and dementia. And many other things are summarized by the blue line in the middle. And basically the message of this slide is that Alzheimer's disease is a 25-year process, starting with amyloid buildup in brain. Many other things then go along, like the tangle formation and the shrinkage of the brain. But the clinical decline, that is dementia, represents the end stage of this continuum. It's only the last 7 years that are the symptoms of dementia. And if we're going to control this and change from the present, as Lauren described, which is without any disease controlling medication, into having Alzheimer's disease be readily treatable, we need to visualize it using scans and attack the pathology. And we know how to do that now. So we now not only understand the disease process very well, but we have terrific candidate therapeutics, especially interventions that remove amyloid from brain, that can actually take a person with an abnormal amyloid PET scan and make that PET scan normal with treatment. And that's incredible, because if amyloid is driving this process, and it certainly starts it off, and we have great evidence that it is the key to drive the whole process of Alzheimer's, we now know how to fix that. And the question is exactly how do we give the treatment? How do we monitor the side effects? How do we demonstrate the benefits? And that's something that we're working very hard on. I will tell you that what we think is that the major breakthrough is going to come with the removal of amyloid before there are any symptoms, because that's when the brain is still functioning normally. If we can remove the driver before all those other changes happen, and while the brain is still functioning normal, we're going to have a major advance in therapy. We think we're on the way to this. In the field, we've had many, many negative trials, but they've all been testing therapies in symptomatic disease, of mild cognitive impairment or dementia. And those are shown on this slide in the red bar. They're on the right side, later stage disease. But we've now launched trials at the asymptomatic stage, shown by that green bar, where we're using anti-amyloid therapeutics now and are starting studies of treatments targeting other pathologies like tangles, but we're focused on this asymptomatic stage when we think removing amyloid is going to have a major impact. These trials are underway. They're long studies. They take years. The first one will be finished at the end of 2022. The next big one will be finished around 2027. So we do still have to be patient, but we're talking about a couple or few years. We're not talking about decades. And that's a major change in our outlook. We've even started to talk for the first time about the primary prevention of Alzheimer's disease. So in addition to taking care of your health and the health of your brain, as Lauren spoke, we're actually headed to a time where we can not only improve the resilience of our brain, but we can actually prevent the biochemistry and cell biology that leads to Alzheimer's disease. We're getting quite close to this, where we can now monitor these biochemical abnormalities with blood tests. And we can do that even before the PET scans become abnormal. And we have candidate therapies that can correct these abnormalities before there's any accumulation of abnormal substance in brain. And that's going to be how we end up not only being able to effectively slow the disease, but actually prevent the disease. So I think that much better times are ahead. I think we've got great progress, and everybody working together, including volunteering to participate in clinical research, everybody working together will get us there faster. I'll stop there. I think I've taken my 10 minutes. Thanks. Thanks for listening.
Thank you, Paul. Thank you, Lauren. So now I'd like, both of you have, there's a sense of futility with this disease because it's progressing over many years, and the absence of therapy that you both noted can fill people with dread. And we've been talking at these times of COVID, it's hardly the message that we want people to hear. So it's, in some ways, it's quite exciting to hear from both of you that there are steps we can take to prevent the disease, and there are opportunities, both therapeutic and otherwise. We are a health policy center, so I want to focus on the difference in the playing field and the way we support these types of activities. So if I, for example, Paul, can understand the biology and intervene early and find a way to remove the plaques that someone has accumulated, I have a pathway to a drug. It may have side effects, but it shows enormous promise. It'll get covered by insurance and hopefully will prevent this cascade of negative implications. On the other hand, if Lauren and her HFC group figure out just how to get everyone to go for a walk and eat right, she gets no compensation from insurance companies. No one will hand her hundreds of millions of dollars. And yet, in some ways, it could have as big an effect as some of these treatments. Are we de-emphasizing prevention, or how has the public policy playing field tilted so much in that way, and what can be done about it? And I'm going to open it up to both of you to respond. I don't know which one of you. I'll let Paul go first because he's off mute right now.
Well, I actually think there is some movement, Dana, towards incentivizing a healthier lifestyle. You and I are both faculty members at USC, and starting, I think, just a year or two ago, every year in November, every person who is insured, has health insurance through USC, is asked to complete some questions and follow some steps to lower the cost of their health insurance. And those steps include things like not smoking. You're asked about your diet. You're told what some of these things mean. And that's a financial incentive. So your your dollars go further if you follow their recommendations and if you have some screening blood tests. So that's just the start, but I think there's a recognition of the importance, not just for Alzheimer's disease, but for vascular health, for so many aspects of our health, to important lifestyle decisions, starting with not smoking, but going into all the issues that Lauren mentioned: healthy diet, check your blood cholesterol, check your blood pressure, check your blood sugar, exercise, keep your brain active, maintain social connections. I think these are becoming increasingly understood, and we will be moving towards incentivizing people to follow that kind of advice.
Yeah, I'll add, and I'm not studied quite enough on the topic, but if anyone is familiar, and I urge you to read about blue zones. It was created by a very smart man named Dan. I'm not going to say his last name because I don't want to pronounce it correctly. It starts with a B. And basically, he has, in these blue zones, creates a very brain healthy, overall healthy lifestyle for cities. And I urge everyone to look up the California Alzheimer's Task Force. We actually just released our recommendations last week, and potentially looking into turning some cities in California into these blue zones, which would thus incentivize individuals, organizations to rally together to find ways to lead a sort of communal brain healthy lifestyle.
Sure, and I don't disagree with either of you that there are some incentives, but in some ways we rely on philanthropy and goodwill to prevent disease, and we hope that someone will be so altruistic that they'll come up with a good idea and share it with the world. When it comes to drug discovery, we say we're not going to leave it to altruism. We're going to provide patents, financial incentives, and R&D machinery to try and do it. We have NIH, for example. And so I do think, I don't disagree with either of you, but I think my point would be that we are remarkably underinvesting in the prevention of disease in this era. And, you know, part of the reason we don't understand a lot of the effects that Lauren is talking about is because there's no incentive to study these.
Well, I want to, and I'll add, you know, not to sound like a negative Nancy, but in our, you know, conversations with people who are looking to support us and our organization, individuals don't even quite fully understand the value of brain health and prevention. They are so focused on donating toward research for medication, research for a cure, and yes, wildly important. It's not that that's not important, but to sort of reframe the mindset of, well, maybe we can delay this disease for 10 years. And then in 7 years, maybe we have something that can take away beta amyloid, and we've prevented the disease for 7 years, and we can access those drugs. And so I think it's, you know, it's policy. It's a shift from medication as a cure-all, and we maybe need to put in the work ourselves and modify our lifestyle so that these cures can work, or that, you know, they can eventually be invented.
But Dana, I would disagree with your suggestion that we're not studying non-pharmacologic intervention. NIH very much is committed to studying many things, including exercise and vitamins and relaxation techniques and many lifestyle interventions, including the impact of blood pressure and blood sugar on brain health. So there are certainly over 100 studies in progress funded by NIH, not so much by the pharmaceutical industry, obviously, but by NIH. So we are learning. I will say that it's harder to do those studies than it is to do drug studies. So designing them and controlling them, making them scientifically rigorous is not an easy task, but there is a lot of effort going into that.
Yeah, and actually, I mean, the point that both of you are making is that this is such a pernicious disease, and we've done the modeling at the Schaeffer Center, Julie Zissimopoulos and others that, we should be, that the budget for that type of research should be increased by a factor of 10, to be honest. So
Sure.
NIH can't hate that message. So, but I do think that, Paul, there is a lot of promise, and I agree with you. And there's a lot of unmet need. And as economists, when we look at these trading off these risks, we realize that it would be very valuable to have a therapeutic that we think could be effective long-term in the marketplace. People could take it, understanding the risks, make very personal decisions with their doctors, especially people who have these genetic predispositions. And we have a aducanumab, which has come through with a lot of study, and not without controversy, but certainly has shown efficacy, certainly safety and efficacy relative to the risks, in my view. And now we have an FDA advisory committee that's recommending against approval. What is going on there? And, have we tilted the playing field the wrong direction and forgotten about patients?
Yeah, so it is a very interesting story. It's quite complicated, but let me just briefly summarize what's going on. Aducanumab is an antibody that attacks amyloid, and it was the first treatment of any kind that was not only able to change amyloid a little, it was able to normalize the brain, to remove amyloid, to normalize the PET scan in a person. It does carry certain risks, but as I agree with you, Dana, those risks are manageable. Based on the early studies, Biogen launched a large phase 3 studies of aducanumab. Now, those studies were launched in what I would call late stage disease. They're symptomatic people, so that was part of the red bar I showed you. But in those studies, the aducanumab successfully removed amyloid. There were 2 of the studies, and in one of the studies, the removal of amyloid was associated with the slowing of clinical progression. And in the other study, that wasn't seen. There are a lot of reasons why the 2 studies had different findings. Dosing was adjusted midstream and differently in the 2 studies. But because the results were not robust, the studies were actually stopped early. And it was only detailed analysis that suggested that, in fact, the overall conclusion would be positive. The analysis was complicated, and with the 2 studies showing somewhat different findings, it's not so surprising that the advisory committee had trouble recommending this. But it is, whether it gets approved or not, and we'll find out that sometime before March 6th, whether or not aducanumab is approved, it is proof of concept that we can remove amyloid, and that removal of amyloid is linked to slowing progression. It's my strong view that I hope we will prove over the coming years that by using an antibody like aducanumab that removes amyloid and doing it before there are any symptoms, when the brain is still healthy, we will have robust benefit that will make advisory committees readily sign on to approval, and this will get to the clinic and will change the course of the disease.
Lauren, I want to add something to that, but I wanted to give you an opportunity to respond as well.
Oh, I mean, I think Paul, spoke to all of that very well. I said this when we first spoke. I think from my point, which is so much as like a patient advocate, daughter of, granddaughter of, I said, throughout the years, there's always a adalimumab or whatever about to be approved that doesn't get approved, and I've gotten my hopes up and disappointed, and hopes up and disappointed. And the truth is, one day it will get approved and it'll work, and it will. And I believe that. And that's why we have to keep going and we have to keep investing. But I have, I always say, what I learned when I worked at the Gap before I started college, which was like, sometimes you're just out of the genes. But there's always something you can do. You can call another store, you can find them in another wash. So what we can do now is take care of our brains. We can focus on being brain healthy and the things that we can change until the latest amilimumab gets approved, whether it's, this one or another or whatever.
But I do think I agree with you, both of you, but I will say one of the things this advisory panel, and I'm biased, I've advised Biogen because I think this is a super important drug, but one of the things this advisory panel said is that if they approve this and it ultimately showed to be a failure, that it might discourage future innovation. But I don't see it that way. It's the exact opposite. If you let this out and put a warning on it and had a very narrow label and said, we are so desperate, we're going to try, that it would encourage more innovation. So again, I think this is all about how do we find the next story. But I want to come back to something you said, Lauren, which is, and we have one of our colleagues, Darius Lakdawala, has done work on this, which has said that if you're in an area where there's a lot of innovation, then if you can make modest progress, you can have a great benefit because you essentially live to see the next therapy. And we saw this in HIV, for example, where AZT kept a few people alive long enough to live to the era of Halt. And so if we would just take care, we don't have to take care of our brains for 25 years. If Paul's right, we just have to do it for 7 years. And it's a much easier hill to climb, I think, for people. And so it's not that we are trading off prevention against therapeutics. They interact together in a positive way.
Well, and I think that, it just overall health will contribute to how a medication affects you. So living a brain healthy lifestyle will maintain the rest of your body's health to make you able to accept these drugs and have them work on your body. So they have to go hand in hand. They have to.
Right. By and large, a brain healthy lifestyle is a heart healthy lifestyle. And we should be adopting this. And to your point earlier, Dana, we should get that message out. More people need to understand that, and we should incentivize them, and we should add to it with effective treatments. And that's really the path forward.
So we're running out of time. So Paul, I wanted to ask you one last question, which is Lauren started as a screenwriter. She became a director, producer, philanthropist. She learned the science, and she's now contributing in that realm. What the heck are you doing with your life, Paul? And do we expect a Netflix documentary soon from you as you switch careers?
I'm certainly not going to make the documentary, but I think that the scientific community in the Alzheimer's disease field is the best of science anywhere. It is highly collaborative. It has embraced the idea of sharing everything we do as we do it. So we collect data and we share it. We learn from every step, from every negative trial. We learn things, and the next trial is better. We revise our view of everything. By working together, by collaborating, and by sharing, we've made an enormous amount of progress so that we really are going to see big changes in just the coming few years. And I am going to continue to work with all of my colleagues around the world, and we are going to bring effective treatments. We're going to work with people who are not on the science, on the medicine side, to get the message out about this disease. We're going to combine lifestyle recommendations with medications. Ultimately, Alzheimer's disease is going to be somewhat like heart attack, myocardial infarction, where in the last 10, 15 years, by combining lifestyle changes and effective treatment and monitoring, so monitoring your cholesterol, taking a statin, exercising, and then taking advantage of the other medications that help your heart and help your coronaries, the morbidity and mortality from heart disease has plummeted, a great success in medicine. We can really visualize this in the Alzheimer's disease field, where in addition to the lifestyle changes, we think we know how to monitor, do a cholesterol test for your brain, monitor people in midlife, and we think we know how to find a statin for your brain. And we are going to change everything and dramatically reduce the impact of Alzheimer's disease on world health.
Okay, is that screenplay gonna get funding at Netflix?
It sounds like a comedy. I don't know.
Well, I think we're out of time. I just want to thank you both for your contributions to the field and your willingness to chat with us. We'd hope to do this in person, but it's been great to speak with you. And thank you to the audience for participating, and everyone have a very nice day.